Degenerative diseases of the spine and the joints of the body are a leading cause of age-related limitations. Hips, knees, shoulders, and fingers are high on the list for pain, stiffness, and just plain feeling old. Osteoarthritis, rheumatoid arthritis, and a whole host of less common degenerative and arthritic disorders stack up to pull the rug out from under the golden years. Hi, I'm Dr. Dave Campbell, and even though I enjoy bringing you messages about a broad array of medical and health topics, one that I am most familiar with is disease and damage to the spinal cord. You see, I'm a practicing spinal surgeon and have performed at least 5,000 operations just on the cervical spine, the neck, working around and on the spinal cord. I'm going to give you my perspective on this disease, one that is more and more common as longevity worldwide is increasing. As baby boomers in the U.S. start to hit those golden years, disease of the spine is just one of the hammers that will fall. To my calculations, I have treated at least 10,000 patients in over 20 years with myelopathy and advised them of this disease and its implications for quality of life. It turns out that cervical spondylotic myelopathy is a degenerative spinal condition and the most common cause of spinal cord dysfunction worldwide. The news today is of a very informative recent study led by Dr. Michael Failings out of the University of Toronto and published in JBJS. He is a leading scientific expert on this topic. My experience, which is bolstered and confirmed by Dr. Failings' study, is that surgery is often beneficial to patients with cervical spondylotic myelopathy. Surgery to relieve pressure on the spinal cord by removing those bone spurs, disc herniations, and calcified tissue, widening the bony tunnel through which the spinal cord passes, generally arrests the deterioration of spinal cord tissue and therefore stops the further loss of neurological functioning from the disease. Spine surgery is common worldwide, especially in the U.S. Many of you will know someone that has had a disc operation or laminectomy in their back, or a cervical spine operation on their neck. But when the spinal cord is damaged, the ability to walk, use your hands, keep your balance, and even urinate properly is devastating to quality of life. It's those golden years again. What patients and doctors can take home from Dr. Failings' study and my own clinical experience is that identifying cervical myelopathy early, before it is severe, is extremely important. Once the spinal cord is damaged, it only gets worse, and the recovery from treatment, including surgery, is more limited. Also, factors that worsen the outcome from surgical treatment, really any treatment for that matter, includes getting older, smoking, having heart disease and blood vessel disease like stroke, heart attack, and hardening of the arteries, which is often associated with high blood pressure and smoking. Also, already having trouble walking or using your hands for simple daily tasks, like grabbing your keys, opening a jar. Just opening the door is a bad sign. Your family doctor is in the best position to identify the signs of myelopathy early, because surprisingly, disease of the spinal cord can be painless and progress so slowly that the patient and even their family don't notice it. Cervical myelopathy can also be missed for many years, and once the spinal cord damage is severe, the results of treatment are not as good. Knowledge is power. Take this knowledge about the spinal cord, file it away, and hopefully you will never need to pull it out. Have a good day. Until next time, this is Dr. Dave Campbell, a spinal surgeon, bringing you medical and health news that I find relevant to your health and wellness. Thank you.